Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a chat with the Islamic Medical Association. We're coming to you from the IMA convention at the Wanderers. It's the 27th of April, Freedom Day. We've had a fantastic program. We've spoken to some of our guests earlier today. And now we have Dr. Ibrahim Patel. Assalamu alaikum wa rahmatullahi wa barakatuh. How are you doing? Ibrahim is a dentist and he gave a fantastic session or talk today. I wasn't there myself, but so I heard on orthodontics, or sorry, let me get it right, on endodontics, and he'll tell us what that is about, Ibrahim.
Okay, so essentially endodontics refers to the dental pulp in the periodicular tissue.
So
and
inside the teeth.
inside the tooth.
Right.
And we basically the gatekeepers between someone keeping their tooth and extracting it.
Right. Okay.
And so we the guys are going to save your tooth.
Right. So this is like the core supplying nutrition, nourishment, and so forth inside the tooth, keeping it alive.
That's correct.
Okay.
That's
And if that dies, the tooth dies.
The tooth dies.
So your job is to make sure that that stays healthy. Am I right?
So a lot of the times what happens with endodontics is that patients are in severe pain.
Right.
And they often flinch at the very mention of the word root canal
Right.
because of the media hype around it.
Yeah, I mean, that's a very media American thing, you know, you're going for a root canal. I don't think I'd heard the term root canal before it was on TV. We just went for fillings before.
Correct. These days it's a sought after treatment because
Okay.
it's one of those that will ensure we keep the tooth.
Right.
It's actually a very painless procedure
Okay.
if done correctly.
Right.
And like I say, it's the last resort for someone to get to keep their tooth.
Okay. So normally, who would pursue a root canal treatment? What type of individual or patient would come to you and you would determine this person needs a root canal treatment?
So it's often when the nerve is damaged beyond
Okay.
repair.
Right.
At that point, we know that the
Okay.
patient needs a root canal.
So the patient would manifest with pain or with
So
the
severe pain.
caries or
It's the
okay.
type of pain that keeps you up all night, can't
Right.
eat, you can't
Just
sleep.
you talking about it makes me.
Just a lot of discomfort beforehand.
Right.
Yeah.
Okay. And so they would come in, you would do an examination and identify that the issue is in the root of the
Correct.
tooth.
It is regarded as an emergency procedure,
Right.
the initial treatment. And so often when patients come in, we would begin immediately.
Okay. I mean, from a layman's perspective, because I think one of the things which patients are afraid of the most is the unknown. Because one of the things, if you go to a dermatologist and you can see him actually examining your skin, you go to a cardiologist, you can see what they're doing. But with a dentist, really, you're almost in a vulnerable position. You're lying there, your mouth is open, and only he knows what he can see. You can't look into your own mouth in reality
Correct.
unless you had a
Yes.
mirror, and it's not practical. So I think one of the things which may alleviate the fear around patients if they had a basic description of the treatment, would you be able to do that? Maybe give us an idea.
Yes,
The
no,
basic-
definitely. I think so. One of the main things we often tell our students, as a dentist, you need to provide information.
Right.
And especially when it comes to something like a root canal, because like you say, your patient doesn't know what you're doing,
Right.
you need to give that
He doesn't even
information.
know there's a root of a tooth. You know?
So essentially, it starts off with us explaining that there is actually a nerve within the tooth, and
Right.
each tooth has its own nerve.
Right.
And when we need to do a root canal, it means that that nerve is damaged, and we need to remove that
Right.
nerve.
Right.
So what we're doing is that we drill into the center of the tooth
Okay.
and get into the canal that houses that nerve.
Okay.
We then clean that out,
I
disinfect
mean, obviously,
it.
you first use liberal amounts of anesthetic. So
Definitely.
Okay.
So we make sure our patients are completely numb
Right.
so that they do not feel a thing.
Right. And then you drill through the top of the tooth usually.
Through the top of the tooth.
Okay.
Often there is a cavity present, so
Okay.
that guides us.
Right.
And like I say, we get into the canal, we remove the infected.
Where does
and
X-ray
skins.
come in this procedure? Because I see a lot of dentists will do an X-ray
So
to identify.
there's
okay,
actual multiple X-rays in that when you're doing a root canal, as a dentist as
Right.
well, a lot of it is done by feeling.
Okay.
In that the only bit of visual information that you get is via an X-ray.
Okay.
And so you'll often you'll observe dentists taking at least 4 or 5 X-rays
Okay.
for
To
root
see
canal.
how far they've gone or what they've done.
Because we need to make sure we get to the correct levels, that we're cleaning, preparing properly,
Okay.
and then filling as well. We fill the entire root system.
And what do you normally fill it with? So you basically would drill in, clean out all the material in there, which may include the nerve root, which is there.
Nerve, blood tissue.
Any blood, any debris, infected tissue, and so
Correct.
forth. Do you sometimes need antibiotics prior to this type of treatment, or because during this treatment, or would it be advised
So-
as routine?
one of the things that we must stress is that the tooth is a connection between the external environment and the sterile body.
Right.
And so when bacteria get into this root canal system, it can go beyond the tooth into the surrounding bone.
Right. Or even into your bloodstream.
And when that occurs, then you do require antibiotics.
Okay. So if you suspect there's an infection which is extended beyond just the nerve root or the pulp, you would give antibiotics. It's not routine.
So it's not routine. If we can control the infection with conventional endodontic therapy, then we don't prescribe.
Right.
It's only when the bacteria are spreading through the tissue.
Right.
that
Obviously,
we
there's some
prescribe.
particular patients.
So there
who
are
may be
systemic symptoms at that point.
And there may be patients who are susceptible to certain problems, like with heart problems and so on. Who may
Correct.
need
So our
antibiotics for
immunocompromised
other reasons,
patients,
for
yes,
other
definitely.
reasons. Okay. So once you clean it out, you said you fill it. What do you fill it with?
So
Cement.
we fill it with material known as gutta-perca.
Okay.
It's actually over 100 years old,
Okay.
and it's one of those materials in dentistry that have stood the test of time.
Right. It hasn't been replaced.
With the most modern of advancements, you find that it is still gutta-perca
Okay. Okay.
that we use.
So what is it? What is it actually?
So it's actually comes from a natural tree from Malaysia,
Right. Okay.
believe it or not, and it's a natural rubber.
Okay.
It's a polyisoprene that we use.
And what makes it so good? It doesn't inflame the immune system.
So
it's sterile.
the best part is that it's inert. It's not toxic. It won't
Okay.
cause any problems.
Right.
It sits there. It fills a space, and that's it.
So I mean, nobody gets metal fillings, or is that a separate thing? Mercury fillings and those type of things. They
So
don't happen
yeah, so the
anymore.
mercury, the silver fillings refers to amalgam.
Okay.
That's more filling that we place on the
on
top.
the top of the tooth.
That's
Okay.
it.
So
So it
that's
doesn't actually
separate
go
from
into
the
the root
filling
canal
that you're
at all.
using.
Yeah,
in
this
the-
is
in
different.
the
This
root
is
canal.
just a root filling.
Okay.
So to
So I
speak.
mean, once you've done this procedure, the nerve root is dead,
The tooth is dead.
and then
yes.
so what happens to the tooth? Does it deteriorate on top of it?
So
or
the
does
tooth
it live?
remains in the mouth.
Okay.
We often advise our patients to have something called a crown
Okay.
at the top, and it's simply like a cap that goes over the top
Okay,
of the
okay.
tooth, and that makes sure that the tooth retains its strength.
Right, right.
And provided that the oral environment is kept clean, that can last a very long time.
Okay, no, that's excellent. So, obviously, this type of procedure would prevent you from needing to extract the tooth. So, the anatomical function of the tooth in terms of chewing, mastication, all that can continue.
That's
but
correct.
worst case scenario, now you lose a tooth. What are your options for you then?
So once you lose the tooth, with
Or
modern day
let's
science,
even before we get there,
Yeah.
what would make you take out the tooth and not do a root canal? If there's not enough tooth left.
so at times it's whenever we decide to do a root canal, we need to make sure that the tooth can remain in the mouth.
All right.
So we need to be able to restore that tooth after
Okay,
we do the
okay.
root canal. So any factor that hinders that tooth staying, like fractures, for example,
Right.
will necessitate removing the tooth.
Okay. So then, say the tooth is out, and obviously, if you lose the tooth, it may affect your ability to chew
Mhm.
appropriately. So, what are the options for you at that stage?
So once you lose a tooth with modern day science, we have things like implants
Okay.
that we can place in, which essentially replaces the root of the tooth,
All right.
and then you would you'd restore that with a crown at the top.
Right.
If patients who don't want to go that route can still have a
Right,
bridge,
right.
which is essentially using the teeth on either side as
Right.
pillars
And
to
then you
support an
build something
artificial
in
tooth.
between there.
Correct. So you have an
Okay.
artificial tooth linked to the
Right,
tooth.
right.
So those are options, and even where patients can't afford that, you have the removable option, the so-called false teeth.
Okay. Okay.
that
So,
people can
and those obviously then are created. You can have a false tooth just for one tooth.
Yeah, you can have a single false tooth as
Okay.
well.
And obviously, root canals, the root of the tooth is a universal feature for all your teeth. It's not just some teeth.
That's
Because obviously,
correct,
the perception
yes.
is that it affects more your molars and so on and so on. But it can affect your other teeth.
So
as well.
every single tooth has a nerve supply,
Right,
and
right.
so any tooth can be
Okay.
susceptible to needing a root canal.
Okay. I mean, so that's I think hopefully for many of our patients that fear around going to the dentist can be alleviated. If you have more information and you're able to understand what the dentist can do, if that pain factor is taken away from you. Obviously, the dentist is trained to make sure that you're not going to have that pain. Otherwise, obviously we might as well have barbers removing teeth.
That's correct. I think with modern day science, there are so many adjuncts that we can use to
Yes,
make patients comfortable that any visit to the dentist need not be traumatic anymore.
Right. And in terms of this procedure, it's any general dentist should be capable of doing it. So, I mean, we went through the hierarchy in one of the talks earlier today in terms of dental care. So, I mean, maybe we can go through that after the break. But in general, any dentist should be able to do a root canal treatment.
Yeah, South Africa is a unique country where endodontics is not a specialty.
Okay.
And so every general dental practitioner is trained to be able to perform a root canal
Okay.
treatment.
Maybe we'll come back after the break, inshallah, and discuss a few issues about dental training in general in South Africa. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. We've been talking about dental matters with Dr. Ibrahim Patel. We spoke at length about root canals. So if you're not an expert on root canals by now, or you're still afraid of root canals, I think you shouldn't be. We've had quite a lot of detail, and it really doesn't sound scary when put in the words of Dr. Patel. So we're going to go through now just maybe some of the aspects about dental training in South Africa, because maybe people don't understand where dentist fits in, what's a specialist dentist, what's an oral hygienist, what's a dental technician, a dental assistant, all those type of things. So maybe you can just take us through what are the sort of categories of dental care available in South Africa.
Okay, so at present we have multiple types of oral health science
Yes.
categories, if you could call it that. So you start off with an oral hygienist.
All right.
An oral hygienist is one that is capable of cleaning teeth, and in fact, more recently, there's been a change to their curriculum where they now have expanded function.
Right, right.
And in a setting like South Africa, where we find that a lot of our communities don't have access always to a general dental practitioner,
Yes.
an oral hygienist is a good start.
So I mean, do you need an oral hygienist to clean your teeth, or would just brushing and flossing be enough?
So even though you brush and floss every day, you do require an oral hygienist.
Okay.
It doesn't necessarily have to be an oral hygienist. We do have dental therapists, and the dentists themselves do the cleanings.
Right, right.
But it is necessary because there are areas inevitably which a toothbrush.
So this
won't
is
be
where the
able to-
concept of see your dentist on a regular basis for screening and to make sure that your cleaning is done and all that
Correct.
stuff is done to
Correct.
make sure you're not
Fortunately, a lot of the dental processes, the pathological processes, are quite slow.
Right.
And so if you visit the dentist twice a year, we can often pick that up in the early stages,
right.
and it's very easy to treat.
Right, excellent. So an oral hygienist can do that. You mentioned a dental
A
assistant.
dental therapist.
Dental therapist.
So a dental therapist studies for a little longer
Right.
than the oral hygienist, and they have, shall we say, a little more function.
Right.
And a dental therapist is really one that can go into rural communities and really
Okay.
uplift the oral hygiene
Right.
in those communities. After that, you have the dentist. So dentists in South Africa study for 5 years.
Okay.
And because of the unique community in which we live, we have a very dynamic curriculum.
Right.
And so every general dental practitioner is trained to a certain level in every dental specialty.
Okay.
And so it's always a good idea
Obviously,
to go
because
to a
maybe there's a
dentist
shortage.
first.
There's a shortage of specialists in many of the areas anyway.
Yes, yes. So in order to increase accessibility,
Yes.
we find that by training general dentists,
They
at
should be able
least
to
they
do
can go to that stage where they can refer.
So the scope
to
of practice of
specialists.
dentists in South Africa tends to be fairly broad, and many dentists
Much
can
broader
handle
than worldwide. Yes.
quite a lot of stuff.
Yes.
Okay. So I mean, I think dentists outnumber the others. General dentists outnumber the others by quite a significant number from what we saw
That's
today
That's correct.
from one of our talks. So and then beyond the dentist, in terms of training, in terms of specialization, you get certain specialities.
So there are a few dental specialties in
Right.
South Africa. The one being maxillofacial and oral surgery,
Okay.
and really, it's just that it's any surgical procedure
Right, right.
uh,
Around the head, the face,
around the head and neck
maxilla, the mouth,
Correct.
the teeth. Wisdom
Uh,
teeth, I think, are the famous ones.
We also then have our oral medicine and
Okay.
periodontology,
Okay.
and that focuses more on the soft tissues.
Right. The gums.
Gums, even though our oral med and periodontal specialists also do implants.
Yes, I
as
think
well.
we've seen that on our show before.
Right. We also have oral pathologists.
Right.
So not so much clinical, but they're usually the guys in the labs.
Right.
that
Looking at
diagnose.
under the microscope, looking at the
Correct.
diagnosis.
We have
pathologically.
community dentists,
Right.
and our community dentists really assist government with legislation around
right,
dental
right,
health
right.
and oral hygiene.
And obviously, there's a significant need from that where there's inadequate resources. You need to make the buck stretch much longer, and you need to. I mean, I
Correct.
think people underestimate the importance of dental care. They think, my child's got a bit of caries, okay, so his teeth are going to look ugly. But the reality is, if you don't preserve those teeth in a child, it leads to poor dentition growing up, and maybe malocclusions, abnormal growth of the teeth, difficulty chewing, and that can contribute to problems with nutrition. So, I mean, we see it in many elderly people, they lose their teeth and they don't eat meat as much as before, and they develop significant issues with loss of muscle and so on and so on. So I think the importance of having this integrated dental approach around the country from a community perspective is critical.
Correct. And oral health promotion has been on top of the agenda for quite a few years now.
Yes.
And it's just that before, especially in pediatric dental care, there wasn't much of an emphasis. And people tend to underplay what that does to the adult facial skeleton.
Absolutely. And obviously changes the way you look, as you alluded to.
Most definitely.
Because you lose your teeth, you may not grow out in the same way.
And I think in the current decade, aesthetics is becoming important at a much younger age.
So spending a few bucks on a dentist when you're 6-year-old may save you quite a lot on a plastic surgeon when you're 35. So I think that's the message really there. I mean, Ibrahim, just if you had to give us 5 or 6 things which you think people should incorporate into their daily lives in terms of maintaining their dental health, and the things they should be aware of in terms of, as you mentioned, seeing the dentist regularly and so forth. Can you give us some clues, some tips for the general public?
Sure. I think one of the main things is brushing.
Sure.
That's something that we can't overstress.
Right. Although you can overbrush.
You can overbrush. That's correct. So for a lot of my patients, I find that their brushing time is actually their me time.
Right.
During their 2 minutes of brushing, everything goes through
they
their
look
mind.
themselves in the eye. In the mirror. Right.
Yeah. So definitely that morning and evening brushing.
Right.
And I usually advise my patients to brush after breakfast.
Okay.
Because breakfast tends to be a very sugary meal for a lot of South Africans.
Yeah.
And so I usually advise, yes, rinse your mouth when you wake up, but only brush your teeth after breakfast.
Okay, so obviously you're getting rid of that coffee, tea, whatever.
You're getting rid of that sugar content.
Cereal,
your mouth
whatever
will stay cleaner for a lot longer.
Okay.
In terms of toothpaste, there are many toothpaste on the market today, and I wouldn't go for any specific one. All of them have their advantages.
Okay. The idea is to have the fluoridated, they're all fluoridated.
Well, they're all fluoridated at this point. I think that people tend to undermine the importance of flossing. Okay. And as dentists, we know that 90% of our patients don't floss.
I think 90% of people who floss are dentists. So it's a problem. I think the problem is people perceive it as an activity which takes a substantial amount of time. But it doesn't necessarily have to take that much time.
If done correctly, it takes less than a minute.
Yes.
And you're done. And I think that, again, coming back just to the oral health promotion part, that if you drop into any of your pharmacies these days, it's not just the standard floss that you need to buy anymore.
Yeah.
You get these pre-threaded flosses that you can use.
Yes, absolutely.
You get oral irrigators, which we've seen a lot of success with.
Okay.
And that's something I definitely suggest
to
patients.
That? What is an oral irrigator?
So an oral irrigator is basically water that's used
as a floss.
As for a floss.
Right.
It's used as a kind of like jet powered, so you could call it that.
Very fine stream of water.
Very fine stream of water. It gets in between the teeth, under any crowns, bridges, implants, and
like a shower for
with a lot of our diabetic patients, we see a very good improvement.
Because obviously diabetics are particularly prone to oral and gum disease.
That's correct. Their healing is impaired to a certain extent, and so we find the oral irrigators really help them. Right. So that's something I'd really recommend.
So brushing and flossing. Is there anything else would you recommend regular use of sugar-free chewing gum, which some chewing gum manufacturers advertise?
So the thing about chewing gum, especially the sugar-free ones, is essentially it's increasing your saliva flow.
Right.
And that's always a good thing in the oral cavity, definitely. One of the advices I give to parents is that in this day and age, you cannot stop your child from having sweets.
Yes.
And so instead of trying to prevent it and letting them have it behind your back, rather set aside time where you allow it. You allow your child to then rinse with water to neutralize it, and then let them brush.
Right.
That's definitely something.
So you can manage that risk, especially from the dental perspective. Obviously, you can't brush out the sugar from your thighs. That's there forever. So, no, but I think it's part. So, I mean, you mentioned sugar. And I mean, that alludes to having a diet which is healthy, not just for your body, but for your teeth as well.
Correct.
You know,
Correct.
so obviously avoiding regular sugary foods and sugary drinks, not falling asleep with a milk bottle in your mouth, as many kids, small babies do, and so on and so on and so forth.
Yeah. So a lot of the times we advise parents that, if your child needs that bottle, then just put plain water in
Yes,
it.
especially in the evening if they're going to fall
Especially
asleep.
in the evening when they're going to fall
Yes,
asleep.
yes.
That's correct.
Okay, and then you mentioned the visit to the dentist. You said twice a year.
So ideally twice a year.
Okay.
And like I said, one of the things we often tell our students is that dentistry becomes expensive with neglect.
Absolutely. So I mean, prevention in this case is significantly better than cure, and may allow you then, as we said, to prevent expenses in the long term. Ibrahim, Jazakallah khair. It's been excellent. I think, at least from my perspective, I have a better understanding of what you guys do and what the root canal is, and
Thank you.
I think I'll be less scared. I don't know. And I always say dentists, I'm sure even their wives and kids are scared of them, but I think that's not necessary. Jazakallah. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. I'm Fatima Isak. I'm at the IMA 2018 at Wanderers Club. This is my 16th, 17th conference. I'm not a doctor. I'm not I'm not even a medical person. I'm actually a civil engineer, but my dad is in the medical field, and I like attending the conference as often as I can with him because I learn a lot. I'm a person who loves learning, and I like learning about how to look after myself, nutrition, posture, good footwear, that type of thing. And I also like the Islamic talks. I like the vibe of the Islamic Medical Conference. The fact that I'm around people who are also academic, people in my religion, Islam, and people who I can connect with, essentially. Jazakallah.
Bismillah ar-Rahman ar-Rahim. I'm Ashraf Ilfar. I'm in the IMA conference 2018. I enjoy in having these people, exactly, because they are very amazing people. They are looking for beneficial to everyone. Today and yesterday we have a Quran workshop. It was nice, I think, and I think I enjoyed and everyone came enjoyed, alhamdulillah. Thank you.
Assalamu alaikum, I'm Zahra Esab. I'm here because I don't think that you ever grow out of learning new things. And even though this is a medical conference and I kind of feel out of place because I'm not a medic and I'm studying psychology, it's really interesting to just see where people come from and learn new things. So, yeah.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Salman Khan reporting from Minixa at the IMA. Minixa is the Masjid and Imam Advisory Council. We are here to raise awareness about the plight of our imams. Those are the most important people in our community and they have been neglected. So what we're doing, we're trying to find a partnership with the IMA, which is the Islamic Medical Association, to find out if there is a willing doctor who would like to help our most important people in our community, the imam, the appas, the ustad, and the muezzins, because it's been long that our imams have no medical aid. It has been long, they don't have any continuation plan. They get retired after 30 years and literally they become a beggar on the street. And it is up to us to find the ways and resource mobilization, raise the fund to make sure their well-being during the time of the employment and after the employment is looked after. Minixa and the IMA have formed the relationship to bring the willing doctor and the willing patient to help and find the way how we can assist. And alhamdulillah, at the IMA conference, it is overwhelming that most of the doctors are prepared and also willing to help and find out if there is a patient or anybody from the mosque who is employed by the mosque is sick, they will be able to assist free of charge. And we would like to say thank you very much. And we're calling on our greater Muslim community to do exactly the same thing, to look after the mosque, look after the masjid, look after the most important asset of our community, the imam, the muezzin, the apas, the ustad, and make sure they have the medical aid, make sure they have the written contract, make sure they had a annuity, they had a pension plan, because they are the people who receive the blessing from Allah subhanahu wa ta'ala in the mosque, and they are the people who distribute the blessing. Imagine if they are in a suffering, they're not happy, what will happen to our community, how the blessing will be coming to us. So it's the most important thing. Please join us to raise the awareness and bring better socio-economic condition for the imams in our community. Minixa is there to assist, and Minixa is the Masjid and Imam National Advisory Council. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Ashraf Sumra and I am with Uthman Biosims. Uthman Biosims is a brand new pharmaceutical company that is locally owned and Muslim owned. Alhamdulillah, we are proud to be associated with the Islamic Medical Association of South Africa to celebrate the 38th annual convention. Alhamdulillah, this has been a huge success with many healthcare professionals turning up and coming for the variety of talks and events that took place over yesterday and today. And I believe that inshallah going forward, the IMA as well as its members will grow from strength to strength, and we will be able to maximize the opportunities that we have as a Muslim community to be able to give back to those who need our services and need our assistance. Jazakallah.
In the various fields of the Islamic sciences, in an attempt to get closer to understanding the will of Allah, scholars have studied various specializations, just as you have in medicine. Some are dentists, some are gynecologists, some are pediatricians, some are psychiatrists, different fields. And in Islamic sciences, we have the same thing. You have those scholars who have studied the Quran. They may not know a lot about hadith or anything about hadith, but they know the Quran, they understand the language, and they try to explain what they understand it means. Another set of scholars study what is called ulumul hadith. They study the sciences of hadith, the verification of the authenticity of hadith and how strong are certain hadith. Some are scholars of seerah. They try to study the biography, the context in which the hadith and the sunnah was operating. Some are scholars of fiqh, of jurisprudence. Others are scholars of qira'at and the science of tajweed and recitation. Some are scholars of usulul fiqh. They study the principles. They are like your industrial pharmacists. They are the ones who try to study the methodologies of coming up with rulings where the Quran and Sunnah may be ambiguous or silent. Some are scholars of qawaid, of the maxims of Islamic jurisprudence. These maxims are articulations of the spirit of Sharia. And some are scholars of maqasid Sharia, the objectives, the intent, the higher purpose for which Islamic legislation is meant to fulfill. And if you don't know and don't care about these specializations, the problems we have for health workers, for anybody else, is similar to people coming to hospital and taking a pregnancy case to a dentist. Just because somebody is called Maulana or Sheikh or Ustaz doesn't mean they are a jack of all trade and a master of all. Scholars have their specializations, but we usually do not identify these specializations, which would have made it clear what this scholar is good at and what he is not good at.
So I think when I first was given the task of this topic, I decided to find out what do we actually mean by burnout. It seems to have become this mass phenomenon receiving constant media attention. More and more people are missing work and school due to burnout. But is this set of symptoms a clearly defined illness? How is burnout different from depression and anxiety? Wellness, on the other hand, is an active process of becoming aware of and making choices toward a healthy and fulfilling life. Wellness is more than being free from illness, it is a dynamic process of change and growth. The World Health Organization talks about it being a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And the National Wellness Institute describes it as a conscious, self-directed, and evolving process of achieving full potential. So this is just a little bit of statistics on the rise in the number of sick days in 13 years, and it's a 466%. And I'm sure every doctor in every profession is faced with the challenge of patients requesting sick days because they're exhausted or tired or burnt out or various other reasons. So the term burnout itself was coined in the 70s by the American psychologist Herbert Freudenberger. He used it to describe the consequences of severe stress and high ideals in helping professions. Doctors and nurses, for example, who sacrificed themselves for others would often end up being burnt out, exhausted, listless, and unable to cope. Nowadays, the term has jumped not only from the helping professions or for the dark side of self-sacrifice. It seems it can affect anyone from stressed out careerists and celebrities to overworked employees and homemakers.
And so that was an excellent session. Things are really buzzing here at the convention, alhamdulillah. Following his fantastic talk, Dr. Patel gave us a wonderful summary now on basics of root canal treatment and some of the underlying concepts around dentistry. And we look forward to seeing you soon. Yaqub will be back.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the ITV program at the IMA convention. And we have Dr. Asma Sallu, a pediatrician in the public sector. She has been the program coordinator. A lot of hard work she has put in. Assalamu alaikum wa rahmatullahi wa barakatuh, Asma.
Walaikum salam wa rahmatullahi wa barakatuh, Yaqub.
Jazakallah khair. You must be really, really tired after all the hard work you've done over the last few weeks. But Allah reward you for that. The annual IMA convention, Islamic Medical Association, you've been the program coordinator for this particular one. And generally we labeled it as the academic program, but it's beyond just normal academics as we know it.
So the program, alhamdulillah, it's been finally, after quite a few months of working on it and stuff, we've finally gotten to the point where we actually can see the program in action, and that's been quite heartening. The program is a combination of both medical topics as well as Islamic topics. And I think the Islamic Medical Association is in that unique position where we Muslims first, and we have our health profession, and that's what we do every day. And so trying to actually marry both together and practice in a ethical Islamic ways becomes an important thing for many Muslim professionals. And the aim of the convention is to try and find that balance between the two. So our program is, yes, there's lots of medical topics, and most of the people, because they come from a variety of different medical professions, different disciplines, and not just doctors, but other health sciences disciplines as well. And so most people, for their actual speciality, will go to conferences for that speciality, and that's where they'll get the primary medical knowledge. But the aim of this conference is to try and marry medical stuff together with the Islamic perspective. And so we've got a huge mixture of topics, both from a medical point of view as well as from an Islamic point of view.
Alhamdulillah, and you mentioned that it's just not medical as we know it, it's the health professionals that are here, and there's a very integrated program. And for the first time, IMA has actually had different disciplines in the same plenary, like a dental program and a pure medical talk. We've also got the allieds, the optometrists, and we've also had practical workshops. So it's a very good mix. But how did you get this right?
So I think it's all down to a huge team that has been behind this, and we've had people from all of the different disciplines. And so we usually have the optometry and the dental streams to the program. And this year what we've done is we've had quite a few integrated sessions, and what these integrated sessions try to achieve, so it's doctors, dentists, dietitian, the allied health workers like the physiotherapists, occupational therapists, and speech therapists, as well as psychologists, all involved in the same session, discussing an approach to specific patients. So the two that I can give you as an example is the one we've got a session on the elderly and celebrating the elderly, and we've got people giving different inputs, from medical inputs to caregivers inputs to some of the dietary issues and the pharmaceutics in treating elderly patients. And we have another one on early childhood development as well, that looks at different disciplines, looking at the process. And these integrated sessions seem to work quite well. And in reality, that's how we would manage those patients. You need a multidisciplinary team to actually manage these patients.
That is so true. And also topics that affect the community and impact on the community. It's not just talking about a one-on-one interaction. We've had a session on child abuse, sexual abuse, a sociology program. We've had something that affects the community at large. A very controversial topic last year was the vaccination. And we've brought in ulama with that, and you've given the Islamic perspective. So your objective for programs, that kind of content, was obviously to enlighten the delegates here that they should be practicing comprehensive holistic medicine, and also making them aware for those that don't encounter that kind of thing. Was that your main reason behind that?
That is, so if we use just the vaccine session as an example, so the vaccine session came about in response to the measles outbreak that happened in 2017, and it happened across the country. In Cape Town, we had our own outbreak in Gauteng, in different places in Gauteng, and then there was an outbreak later on in the year in KwaZulu-Natal, and they all had similarities to it, but differences as well. And it was important to address the issue, especially seeing that a lot of the index cases were from within Muslim communities, and there's a large problem of non-vaccinated or unvaccinated communities within the Muslim community. So it was important, as a health or an Islamic medical association, and as an organization that deals with health professions, to actually address this issue. And the panel discussion was actually really useful, because we had pediatricians and medical people, and we had Mufti Zakaria Pando, who's from the Jamaat al-Ulama, and he had very valuable insights to add into that. And at the end of the day, all of us are talking the same language, but it's about getting people to sit down in the same room and actually interact. And you realize, just from sitting in the panel discussion, and just also from a lot of the feedback we got from the audience, there's a need for us to sit down and talk about these issues on a regular basis, not just at conventions like this, but maybe going forward, there's actually a project there that needs to be done so that we can improve our vaccination rates within society.
Alhamdulillah. And obviously, from what you're telling me, and you look at the program tomorrow, it will continue. We have well-known ulama also coming to speak here tomorrow in the form of Mufti Mank, today at Mufti Pando and Maulana Bam. So bringing these ulama into the program is also to show the comprehensiveness of what we as Muslim health professionals should be doing, is to integrate our practice and our behavior and whatever we do, bringing the Islamic element in and getting advice from the ulama, and the ulama themselves also learning by being present here on the technical, medical, scientific side. And it's a good kind of partnership. And we've also got a fantastic scholar from Nigeria, Sheikh Nuruddin Lumo, with his wife, both Islamic scholars, and their input has been valuable. And the feedback we've received so far from the delegates is been like really, really impressed with Sheikh Nuruddin and all the other talks. And what's your take on that kind of mix?
So I think it's really valuable, and we can't exist in silos. So having both sides of the spectrum, we Muslims are on the one side and we health professionals on the other side, but we can't be health professionals only at work and Muslims only in our home life. So that has to be integrated, and I think that this program tries to do exactly that. And I think we're managing to get that balance of both an Islamic and medical perspective. And yes, our guests have been excellent, both our local guests as well as our international guests, and there's lots of very good input that's been coming out as well.
It's not only about the delegates and the health professionals, because we always try to have a family convention. So you've also catered for the spouses that are not medical or not in the health profession, program for youth, program for kids. You want to tell us a little more about that?
So yeah, as exactly as you were saying, there's a parallel spouse session that runs throughout the program, and there's a student session. So we've got a
Yes, of
session
course.
for university students, and
Yes,
this
excellent.
not just medical students, but all the health sciences students. And then there's the program for older kids and younger kids as well. So there's something that's age appropriate and interest appropriate as well for everybody, literally, like you said, the whole family. So it's a long weekend and people don't want to leave their families to spend more time at a conference, which is looked at as work, but at least it's an opportunity to bring their whole family and make it a family event.
And also provides an opportunity for the delegates who haven't met each other over the years, or even since the last convention, to interact, old friendships, also to engage with each other at either at a work level. So there's a nice social interaction between sessions.
Absolutely. So there's a lot of networking opportunities as well. And it's just that sometimes as Muslim health professionals in different disciplines and from people from different parts of the country, sometimes you have the same kind of issues. And it's at conventions like this where you get to meet other people, exchange ideas, and meet old friends as well.
Okay, and then your program, of course, Salah is the pillar of Islam. Your program has been designed such a way that it is structured around Salah times.
Yeah, we've tried to do that. We've tried to create the sessions, keep them short enough to keep the interest of the audience. And as well, we've tried to rotate it around the Salah time so that we actually prioritize Salah, which is part of our normal day.
And for the barakah and blessings in teachings, your sessions start with the Quranic ayah. Yeah. So there's a fully integrated, quite a nice, well planned program.
Inshallah, I hope so. And we've tried to also, even the ayats of Quran, we've tried to relate it to what the topic of the program is, which is sometimes not that easy, but that's what we've tried to achieve.
Dr. Asma Sallu, well done to you and your team, and Jazakallah khair. I'm sure you're going to need some sleep on Sunday. But in wrapping up, what is to be expected for tomorrow?
I think we can expect another full day tomorrow with lots of very interesting speakers, very interesting topics, and I think it's at the end of most conferences you go home feeling like you have information overload, and I think it's not going to be any different here. There's just so many different things that need to be covered, and so I think it will be another exciting, fun full day.
So for the viewers and those that are in the health professionals and missed out on this convention, please do remember these are really very good conventions. We get fantastic feedback from the delegates, really hard work being put in by the committees, and we'd like to see you again at next year's convention in Cape Town. Details will be sent out, and IMA, as Asma has said, it's Muslim health professionals bringing Islam and making sure that the priority of worshipping Allah first before everything else is what we should be doing. Work is part of what we should be doing. Dunya is something we have to do, but we have to care for the akhirah. And this is an integrated 2 days, a fantastic program where there's learning, interaction, exchange of ideas, and may Allah bless this convention, the committee, and everybody that's attended here. Assalamu alaikum wa rahmatullahi wa barakatuh.